Hey everyone, I'm Scotty from Scotty RNY, and this is my post-op RNY Gastric Bypass update. So I had surgery on Tuesday, July 7th, 2015 at Humber River Hospital in Toronto, and my surgeon was Dr. Hagen. So yes, I had the Gastric Bypass Roux-en-Y. It was a great experience. Well, I guess I slept for most of it, or all of it. No, it went really well. I had surgery at 2 o'clock in the afternoon, and with my recovery time and whatnot, I was back in my room about 6 p.m. and I woke up and saw a couple little bandages, on my stomach. They use steri strips over the portholes now. They don't stitch them anymore. I felt a little groggy, but and some pain, obviously, but otherwise, I was doing pretty good. A couple little things that happened though. Afterwards, later on in the evening, I was kind of shifting around in bed, and I had noticed that there was kind of like a fair amount of blood coming out of one of the portholes, the bottom ones, adjacent to my belly button. So I called the nurse, and they came over and they kind of bandaged it up a little bit more, and they said, "Oh, that's fine, don't worry about it." And then a little bit, later on again, some more moving around, and it started to leak out again a bit more. So they came back over and removed the bandage that was on it and put some more steri strips on it, and then rebandaged again. So there was a little bit of a fair amount actually of blood loss from that one. So later on in the evening, I had to go to the washroom, go pee. So the nurse just gave me a bottle, and she told me to stand up beside the bed and pee in the bottle. So I did that. And while I was doing that, I had noticed some blood, down the bottle or whatever, and I was looking at, kind of bent over to look a little better because I thought maybe it was coming from my urine, and there was a puddle of blood on the floor. So I sat back on the bed and called the nurse, and she came over, and she said the other porthole that was just above my belly button, it was popped open and leaking out as well. So they called the resident doctor, and the doctor came, and she ended up putting stitches in both of those portholes. Just to make sure that they're going to close up really well, and then they put a lot of bandaging on them, and everything was fine. So had an okay night of sleep in the hospital the first night. Wednesday morning the doctor came in doing his rounds, and he just wanted to let me know that the surgery was perfect in his eyes. Everything inside looked great, and I had nothing to worry about, and don't worry about those stitches that I had done the night before, because that can happen, and it's not a big deal. More so, everything inside went really well, and that's the main thing. He had originally told me to go visit him on Thursday for a follow-up, but he said because of the stitches, he said come Friday, it'd be better for him. That way he could take them out on Friday, and time frame was better for him. So I said, okay, thanks very much. So off he went. I kind of got up, so this is Wednesday, I'm still in the hospital, got up, did a little bit of walking around, a lot of pain from the gas and whatnot that you'll have after surgery. Did some walking up and down the hallways. It didn't really relieve the pain, but it did feel good to kind of get up and walk around. And it was about noon on Wednesday when the nurse said, well, you're discharged, you can go home now, because the doctor said you were fine, you're up and walking, you look good, all your levels are normal, so go home. So, okay, and even though I had a lot of gas pain still, I was kind of concerned about it, but they said, no, don't worry about it, get walking and that will go away. Okay. So when I took my gown off, I was looking down, and I noticed where the bandages were, like that side of my stomach was, really distended. So I called the nurse over and take a look at it, and she looked at it, she goes, oh, you've got quite the hematoma there. Underneath the bandages, and she kind of peeked around and looked at it. So they called the resident doctor back. She came and looked at it, and she said, oh, that's fine, that's normal, because of the amount of blood that was coming out the night before, so that's not a surprise that there's that much of a hematoma there, and not to worry about it, because there's nothing they can do for it at this time. It might get a little bit bigger and puffier, but it will go back down and just kind of get back into your blood system and into your body, in time. So don't worry about it. So okay. So went to the pharmacy right after being discharged. Got a couple of scripts filled. One was for Percocets. So when we got back to the hotel room, about an hour and change later, the pain was, again, pretty bad. And I did a little bit of walking in the hotel room, or in the hotel when we first got there, but so I ended up taking 2 Percocets, had a good nap, woke up, and did some more walking through the hallways. No gas coming out yet. So off and on, kind of like that for all evening. And the pain was really sharp still later on at night. So I took 2 more for bed, and woke up in the morning and felt better. I slept the whole night on my back, didn't even move, and the pain was very minimal. So this is now Thursday morning. So Thursday morning felt good. Had a little bit of Greek yogurt because now I'm on full fluid stage. So I had some Greek yogurt, and I mean like a teaspoon, here and there, and some water, sipping, on water, getting that in, and then doing a little bit of walking. Went to the local mall just after lunch, and was there for about 2.5 hours, just kind of walking back and forth. Didn't walk for the whole 2 hours, but it must have been over an hour at least that I did some walking, so that was good. And some of the gas started to come out, and you could really feel the difference almost immediately when it starts coming out. So back to the room later on, and feeling good. Still some gas pain, but again, it was really starting to come out and feeling good. So I had a little bit more of my Greek yogurt. Wasn't eating anything else. The only thing else that I was eating was just a couple of spoonfuls of applesauce with my crushed up meds in it, and then I had a protein powder drink that I had made, and so I sipped on that through the evening as well. So then Friday morning, got up, again some Greek yogurt, more water, and a little bit of walking, and then went to see the doctor, and he was absolutely amazed at how well I looked. That I was up, I was chipper, I was walking around, no problem. And he kind of looked at my incisions and whatnot, and he said, "Don't worry about the staples." He said, told me to have them taken out by the nurse practitioner at the clinic here next week. And he said, good luck, and if you need me for anything, give me a call. So that was really great to hear. So I got home Friday afternoon, and done some more walking again. All the gas is pretty much gone now, so as long as I keep walking, I'm good. The pain is minimal. It's just on the incision sites that it's a little tender. Otherwise, I feel really good. The hematoma, though, it's really taken a change. It's like this big around, but it's just coloring, because it's the blood under, between the layers of skin. But otherwise, there was a couple of drops of blood from that one stitched area, but nothing major anyways. Eating wise, I'm still having Greek yogurt. I've had another couple of protein shakes, one last night, one again this morning, and because this is now Saturday, July 11th, and I'm going to have strained low-fat cream of chicken soup later on, and we'll see how that goes. And that's about it. Everything else is, I'm feeling really great. So I'm going to get up and do some more walking now, and I will come back to you on Tuesday with my regular 1 week visit, because that's my normal weekly visit is on on Tuesdays, and that'll be my 1 week post-op. So I'm doing really well, everybody, and I appreciate all the positive thoughts and comments that everyone has left me so far, and I'll see you guys again on Tuesday. Bye. Take care.